Co-investment is an incredibly important catalyst for advancing community health. But who is the co we're talking about here? Your hospital and your hospital's donors. Many more healthcare organizations are making grants to strengthen local nonprofits, especially nonprofits that work to address the so-called social determinants of health, food stability, housing security, and more. But guess what? Somewhere in your hospital, probably in a different building, is your powerhouse development team. As community health becomes a top strategic priority at your health system, fundraisers are being asked to find visionary donors who want to tackle these areas. Capital is still important for your system, but so are goals like reducing diabetes, particularly among historically and currently marginalized populations. You care about addressing areas uncovered by your CHNA. Your chief financial officer cares about hitting the A1C goals in your latest contract. And your donors? Well, they're fed up with the pervasive health disparities that mean lifespan is shorter depending on your zip code. To my friends in community benefit and community health, do your fundraisers know what your top priorities are? How about your current and planned investments to improve community health? In my experience, your two teams are siloed, physically and sometimes philosophically. Similarly, the co-investment can also mean joining with other community organizations, like independent grant-making foundations, government agencies, or even other health systems to pool investments. You may well be conducting community health needs assessment in conjunction with other organizations already. In other words, you've bought into working together when it comes to identifying the worst pain points in your area. What about joining together to create solutions? It's hard to do this when we don't clearly define and communicate our program goals. In my new research on hospital investment in community health, we're asking about program goals and about perception. It's been fascinating to see what the survey's current respondents are prioritizing. The most common area of investment? Behavioral health, with 87% listing this as a top area for investment dollars. Substance use disorder is close behind, tied with food security. Surprisingly, only 40% of our current survey respondents list housing as a key investment area. Data like this is invaluable for funders who want to close the gap, for hospital development, and most importantly, for you. The survey covers data that isn't found anywhere else. Believe me, I've looked, such as the staffing and infrastructure of hospital community grant programs, approval processes, grant cycles, how much organizations are giving away each year in grants and philanthropic sponsorships. It's data that you can use whether advocating for more staff for your community benefit office or answering a board member's questions about how your hospital's grants compare to others. So I hope that you'll make your voice heard in this 10 to 15 minute survey. By request, we've extended the deadline to Friday, September 24th. All participants will receive a full copy of results and are invited to a complimentary session on October 6th. Thank you for your consideration and for all that you do to improve community health.